Greetings and welcome. Thanks for joining us on the Professor Kareem Ainsley Encounter. It is indeed a privilege and a pleasure to serve you. In this space, we'll be discussing things concerning medical technology, clinical laboratory science, biomedical laboratory science, and even laboratory medicine. For those who are interested in their preparation for the ASCP examination, then this is the space to be to get free up-to-date information so that you can be guided with outside perspective from your standard rudimentary school curriculum while sticking to the core content of that which is required. And even for those who want to specialize in select areas, at the end of each of our subsections, as is stipulated by the ASCP board, you will be able to sit those specific examination designation. However, to enjoy the full gravity of the whole experience, we will have to complete the whole cadre of course material required. We're going to be asking you kindly to utilize the links in the description to be guided to our free resources and our external resource that may be beneficial to you. Don't forget to share this information with any medical technologist that you know or medical technologist that is on the fence of doing the ASCP examination. The information provided here in these review sessions are free and in the public domain. This training session is a guide for the Medical Laboratory Scientist MLS ASCP and International Medical Laboratory Scientist MLS ASCPI examination. The MLS ASCP or ASCPI certification exam is composed of 100 questions given in 2 hours and 30 minutes time frame. All the exam questions are multiple choice with one best answer. The certification exam is administered using the format of a computer adaptive test CAT. With CAT, when a person answers a question correctly, the next question has a slightly higher level of difficulty. The difficulty level of the question presented to the examinee continues to increase until a question is answered incorrectly. Then a slightly easier question is presented. In this way, the test is tailored to the individual's ability and level. Each question in the test bank is calibrated for levels of difficulty and is classified by content area. Content area aligns with exam-specific content outline. The examinee must answer enough questions correctly to achieve a measured above the pass point in order to successfully pass the certification exam. There is no set number of questions one must answer to pass, nor is there a set percentage one must achieve to pass. If at the end of the exam, the examinee score is above the pass point, then he or she passes the exam. That is exactly what we'll be seeking to accomplish. Our process will include a lecture series, then we'll have a content summary. Next, we'll have sample questions, after which we'll have some case studies, and then we'll work on important vocabularies. This whole design will be for the different areas that we will be studying. After each subsection within a specific area, then we'll be able to go through to review the content before we move on to the other area. Coming soon, depend on when you're listening or watching, we'll have our quick facts guide so that those who already have the information, those who are ready to sit the exam, can just flip through with illustrated images and see exactly what it is that they need to remember. In accordance with the guide given by the ASCP, we'll be focusing on the core areas that includes blood banking, which comprises blood products, blood system, blood grouping, immunology, physiology, and pathophysiology, serology, and molecular testing, and my favorite area, transfusion practice. And this area accounts for 17 to 22% of the examination. After we have concluded that segment, we'll be moving straight ahead to hematology because they are somewhat correlated. And in that area, we'll be focusing on the physiology, disease state, laboratory testing, hemostasis, including the physiology, disease state, and the laboratory determination. That too accounts for 17 to 22% of the examination. After completing that area of hematology, we'll be moving into chemistry because this area also comprises of 17 to 22%, in which we'll be focusing on carbohydrate, lipid, heme derivatives, enzymes, protein, and other nitrogen-containing compounds, acid-base determination including blood gas, electrolyte, endocrinology, vitamins and nutrients, therapeutic drug monitoring, and toxicology. Right after we have completed the chemistry, the next area of focus will be urinalysis and body fluid. The reason we're going to go to urinalysis and body fluid thereafter is because chemistry is tied with urinalysis. So we'll just be spending a brief moment in that area because that accounts for 5 to 10%. So we'll be looking at physical and chemical testing, microscopic analysis, physiology, and the disease state. Now that we have completed that, then we'll move to microbiology, which comprises 17 to 22% of the exam percentage. We'll be looking at the pre-analytic procedure for bacteriology, analytic procedure for mycobacteriology, virology, parasitology, mycology, and the post-analytic procedures. When we would have completed microbiology, we'll just be brushing up on some fine-tuning. We'll be looking at immunology, where we'll be covering some principles of immunology, disease of immune system, transplantation, infectious disease, serology procedure, and testing. This accounts for 5 to 10% of the examination as well. But as we navigate from blood banking to chemistry, then through hematology, and in some areas of microbiology, you'll realize that we'll be covering brief aspects of immunology. So when we have completed those areas, we would actually have completed majority of immunology. So we'll just finalize the whole idea of immunology. And to top it all off, we'll conclude our study in laboratory operation, and that there comprises of the quality assessment, troubleshooting, safety, laboratory mathematics, manuals, automation, methodology, and instructions, basic management principles, and educational principle. This area accounts for 5 to 10% of the examination. As you can just imagine, when we are in chemistry, we'll be thinking about laboratory operation in terms of machine and instrumentation, and also hematology and blood banking. We'll have to do quality assessment, assurance, troubleshooting in all those areas. So this will just bring everything together, after which we'll have our final review as we bring the whole being together. And that will be the conclusion of the study for the ASCP examination, domestic and international. We just want to say thank you for allowing us to give you new perspective as the field of medical technology, clinical laboratory science, biomedical laboratory science, or even laboratory medicine. It is indeed a pleasure to serve you. We wish you all the best on your examination as you prepare with us.